Probably when I was a younger man, I wouldn't have thought of myself as being able to aspire to or carry out these sort of roles, but there's no doubt I wanted to see the world change quite significantly in a number of ways, especially in relation to mental health care. And so I've gradually gained enough confidence to take on these leadership roles. My style of leadership, being an Irishman, is I would say fairly uncompromising. I think I'm not really in the business of selling the issue short. I want to see things improve quite significantly, and this idea of incremental change, is not the way I've thought about it. I think we've got to actually crash through, and we've got to, see quantum leaps, paradigm changes. Those sorts of reforms are necessary in mental health. We've just come out of the 19th century in terms of our thinking and our facilities, and we're actually living in the 21st century. So we've got a lot of catching up to do. We've got a lot of investment catch up. We've got a lot of conceptual catch up, and we've got a lot of old-fashioned and divisive thinking to overcome. So I don't think you can deal with those issues and progress them unless you are fairly uncompromising yourself, and you attract sufficient allies both amongst other leaders and other sectors, and particularly with the ordinary people, the grassroots of the Australian community. Those are the sort of allies that I'd be looking for, but I'm certainly not in a mood to compromise on fairly fundamental issues of human rights and I suppose preventable suffering and premature death. As they say, sticks their head up above the parapet in Australia, and probably in any country, has got to be willing to take the risk that there's going to be a lot of resistance, and in some case quite significant attacks on the message and sometimes on your own personality. I certainly have experienced that in the last few months, but it's been driven by resistance to change, I think, and I think probably for the first 12 months or so, in the wake of the Australian of the Year experience, there was tremendous unity in the community and in the mental health sector and in the health sector generally about the need for major reform and investment in mental health care. Now, as investment has occurred, and obviously every problem can't be addressed immediately. There's so many gaps in mental health care that there's a sequence of reform that actually has to be decided upon. Some of the vested interests that have basically seen their areas not receive as much support as they would like in the short term have basically challenged the reform focus, and so that's been a bit difficult in some ways. But I think by sticking to the logic, the evidence and the feasibility, and I suppose the right sequence of reform, we've actually got through that period. So I think that some of those challenges are hopefully behind us now. But there's no doubt that if you are putting your hand up to try to say that the current status quo is not good enough and we need to change it quite significantly, you're going to experience resistance and quite often very personal attacks. And in terms of dispersing stigma, I think confidence, as well as awareness and open discussion, but confidence that we can actually tackle and beat these problems if we all work together, if we tap into our own resilience, and if we support, the same access and quality to mental health care that we see in physical health care. These are sort of, antidotes to stigma, a sense of, talking openly about the extent and scale and scope of the problem across the whole community, and then actually tackling it with confidence and an uncompromising attitude. I think those things really, stigma melts away when you do that, and especially if you involve young people and families in the design and operation of responses and services. So sometimes the kind of conceptual leader isn't very good at practical or implementation aspects as well. So you need a leadership team actually, and I've certainly had one here at Epic and then Origin and later Headspace. So, I mean, I suppose it really is a team game as well. Leadership is a team game. It sounds a bit of a contradiction, but I think you need shared leadership or co-leadership at least. Now that we've actually obtained a moderate investment from the federal government in these innovative new reforms, the main issue is to make sure that these reforms get implemented, at the grassroots level in the community, so young Australians with emerging mental health problems get really good access to the sort of help that they need in a timely fashion. So that's implementation's the next challenge.